I'm Dr. Connie. I'm your host of Mind Your Health podcast. I share my unique perspective both as a practitioner and a patient battling autoimmune condition for over 25 years because I had to figure things out on my own, and my education in my practical approach as a patient allows me to truly integrate it so that you can be whole and the burden of sick care is no longer your own burden to carry. And this is what we help you with in this podcast. Hi, this is Dr. Connie. Today's episode is not so much about something that I want to share with you as far as information is concerned, but I want to share with you some of the insights that I've learned, or the lessons that I've learned, and the insights that I gained from being a practitioner as well as a patient, as well as really getting to know the system, both conventional system, holistic system, all the systematic ways that we do things, and how inherently there are certain assumptions that we all make. And I sort of want to talk to you guys about the things I've had to uncover and really redefine for myself, if you will, about how things work in essence. So here's what I mean. As you guys know, I have lots of didactic trainings in many different fields. And I think part of it, as I didn't know it at the time, but part of it came from the fact that I never really got the answers that I needed. I almost always felt like, I got through the end of psychology degree and feeling like, oh my gosh, can I do this for the rest of my life? And then the answer quickly became no. And then so I got into nutrition, and then I graduated with an RD degree or a master's degree, and then got my registered dietetic certification. And then I asked myself, can I do this for the rest of my life? And then it was like, no, because I've seen some things in the system, in the medical system. And then I got into doctorate in physical therapy, and definitely it was the most intensive thing I've done, and it was pretty challenging. And so in my mind, I had to justify all that education, especially I have a doctorate in it, with that's a lot of schooling. And I still felt this void at the end of the day. And so it wasn't long before I started to veer out, because now I could, because it's postgraduate work. It allows you to sort of dip into many different fields. And so I got really continuing education happy. And I studied everything and anything under the sun because I just have a very curious mind. And my mind works that when there's an open loop, I have to close it and I have to make it make sense. And I just want to say that I'm one of those people that are very left brain dominant, meaning I need the evidence, I need the scientific backing. And because I was in this educational system for so long, I need the validity, I need the efficacy, I need all the research-based findings. And if you're just going to tell me your opinions, I'm going to look the other way. But if you're going to tell me the research behind why it is that something works, then I'm going to listen to you. Well, as I got into the research and as I got specifically into functional medicine, and because I have a master's degree in public health, I studied epidemiology, which is the patterns and trends of influxes of different types of diseases and conditions around the world. And we study the trends, right? And as a registered dietitian, I always knew diets don't work because year after year, there's so many people going on new diets and there's so many yo-yo dieters going on. But yet, even though there's year after year, there's more diets that come out and we become evolved than ever before, we still have a global epidemic now of obesity and all the chronic diseases that are associated with obesity, like diabetes, hypertension. There's autoimmune diseases on the rise, gut issues, cancer. These are all things that are kind of on the rise. And more importantly, I think there's a lot of influx of mysterious autoimmune symptoms And these patients have not been diagnosed, and there's a lot of interest in functional medicine, holistic medicine, integrative medicine, and you name it, right? So I've been around all of this. The first time I realized that health is not something that somebody else could answer for me. For example, I respected the profession of MD, medical doctors, because I know how grueling it is and I know how hard it is to get into medical school. And there's just some like respect that goes there because all my friends were in the medical school when I was going to school, and I know how hard they worked. And I just feel like, or I always believed that there was so much knowledge behind that. But what I've come to realize really upon like really working with my own condition, as well as seeking answers for my own condition, as well as treating my patients and seeing what works and what doesn't, I started to really ask questions. And I'll tell you what, when I graduated from my master's degree in nutrition, as well as a doctorate degree in physical therapy, there is a certain level of knowledge that I came out with, but it didn't equip me to be a good practitioner. Because being a good practitioner is really more about the soft skills of your willingness to listen, the energy and the intention you bring to the meeting with your clients for the consultations, and then your desire and your willingness to help. And oftentimes I think that is exchanged in the medical system for prestige, elitist mindset of certain physicians that are very well endowed or well learned. They somehow think that everybody's beneath them. And I realized as a patient of many of these doctors that there was no humility behind what they did. In fact, they hid behind the science so much that they failed to connect with me. They failed to see me. And in the process, inadvertently, because it's not like they intended to do harm, but because there was no humility in their approach to medicine, that they missed the most important piece of really finding what works for me and seeing me as a whole person rather than the condition that they're treating me for. And it's almost like if they can't treat the conditions, because I have always been an outlier and I don't do what everything happens. Either I get really well or I get really sick and have the opposite effect of what they expect. It's almost like they scratch their heads and get frustrated at me for the effect that my body is having, especially if it's not according to the textbooks that they read and the research, right? So they usually say, this is the way it's supposed to be. I've been doing this so many years and I've never seen a case like you. And well, while that may be true for them, it doesn't help me as a patient to hear that on the other end of it, right? So that's been sort of my story. And when I first went to the functional medical doctor, I remember sitting there, and it was a year where I had like bumped up into very hard revelations about myself in a way where I knew deep inside that if I continued to be in this marriage, that something bad was going to happen to me health-wise, because I knew that I was upset a lot in this marriage, and the stress that it caused raising two little boys and being miserable in my marriage was really, really bad. And the reason why I went and sought out my functional medical doctor was because, number one, I believed there was no escape from my marriage, because it's sort of like in my culture and my belief system is that once you get married, you made that choice, you made that bed, well, you better sleep on it, right? And that's sort of the belief that we held, and there was no question that you don't do anything outside of that, or otherwise you have this scarlet letter A that's going to cause and bring a lot of shame to the family. And that was not something that I wanted to be responsible for, let alone for the happiness and the joy and then the future of my children. So I stayed in that marriage, and I went to the functional medical doctor because of libido issues, because again, I had a difficult time with intimacy with my then ex-husband or then husband. And I just thought something was wrong with me. And I really want you to hear me, right? So I'm in a bad marriage. I'm in a miserable relationship at home. You know, never mind the stress, because I didn't even have that awareness back then. But because I didn't have libido, I mean, do you blame a woman who doesn't have a libido towards the person who stresses her out all the time? Like, there was no love, there was no affection. I just cringed every time he came near me. Like, it was that bad. And here I thought something's wrong with me. So I think that says a lot about the beliefs that we hold. And when I went to the functional medical doctor, I wanted to know what's wrong with me, fix me so I can better, accommodate my husband's intimacy needs, right? And it was at his request as well. And so I went extensive visit. And I think the visit itself was, I don't know, it was a yearly concierge medical practice. So they wanted me to pay $1,200 up front. And then they did a host of tests, which costed over $3,000. And then the results came back, one of which were hormone testing. And she said that I needed to be placed on some hormone replacements, and that should help me. And so I believed her, and I did the Troche option to have a little estrogen, testosterone, as well as progesterone. And I tried that for a while, but it didn't really succeed. And pretty soon after that visit, if I went on a march, by June, they wanted me to follow up. There was nothing in between. They just told me I had a single nucleotide polymorphism, that I needed methylation, methylated B vitamins to be supplemented, and then also to take the hormones, and then we'll reassess again. So I'm down $4,200 with bioidentical hormones. And I get a letter before my visit in June, because they wanted me to follow up in 3 months, and I went to go see them in March. And it pretty much said that the person that saw me is going to be out on maternity leave, and therefore they're going to require me to go see the main doctor, which her main fees were a bit higher than this one. So this is the fee. And if you're interested, come back then. So $4,200. And I needed to pay, I want to say, about $1,800 more to continue their services, and then to figure out what next. Well, I had gotten some hormone replacement therapy and a lot of tests, and the visit. I didn't gain anything. They didn't give me a structured day-to-day life accommodation or insights into what I can do. They just told me to take these supplements, and that was the extent of it all. And then I started to really ask questions, because it's supposed to work. And so in my mind, I was challenging myself to enroll in the best functional medicine program. And back then it was either anti-aging medicine or Institute of Functional Medicine. And so I selected the latter because it felt a lot more reputable and a little bit more academic. And so I enrolled with them, and it began my coursework in becoming certified. And I was able to meet a lot of doctor friends, lots of colleagues who were nurse practitioners, physician assistants, chiropractors at these meetings. And it was pretty intensive over the weekends. And there were many, many different things we had to do. And then I realized certain things about these doctors. They were so adapted into the medical system, and they were bringing their habitual nature of seeing the patient, establishing very little rapport, and still figuring out what's wrong with them, dictating and being the authority figure, so much so that they fail to see the patient. Not only that, in some cases, I started to ask questions, like, because a lot of them didn't really exemplify and demonstrate and embody health and wellness. In fact, it was the complete opposite. They were obese. Their diets didn't look really good. In fact, when I was placed on an elimination diet, like the doctor who placed me on elimination diet practiced whatever. And she pretty much said she does everything behind closed doors because to her patients, she wants them to do this, not do what she does. And then I thought that was such a contradictory way to manage patients. Because for me, the way I learn from my mentors is, or select my mentors is, they've been through what I'm going through and they've successfully come out of it on the other side. And so they know what I'm going through. And then I realized these doctors have no idea what I may be going through, nor do they have any humility and understanding and compassion to want to know what I may be going through. Sometimes when the emotions rise, it was like a lot too much for them. So I just want to make sure that you guys know that. And, at the end of the day, stripped of nothing else, if you see a functional medical doctor, you know that when you go in for the visit, they want to do a lot of tests. They want to prescribe you a lot of supplements. And then they explain all these tests to you, which is a follow-up appointment that requires money, right? And then they give you a handout or something to follow a diet along with. And they don't really have a whole lot of recipes because they themselves don't cook. They don't have any idea what it means to live like that and eat like that. And so there is no creative outlet for them, nor do they know exactly what you're getting into, what they're prescribing you to do. And I think that in itself is a big problem. And I realized, like, me following the plans in functional medicine, like the elimination diet, the FODMAP diet, there's a detox diet, there's different diets for just about every condition. And I followed those diets like religiously for over a decade. And I was really down to maybe about 10 foods that I could eat. And then eating out and going on vacation became really a source of anxiety for me, anxiety and stress, because, if it's not on that list, then it's going to create a lot of inflammation. And did I really believe that? I'm not sure. But I did believe in functional medicine. I did believe in the research. I did believe in all the things. Fast forward to today, you guys, the truth is there's so many different diets out there. Just this morning on my way to work, I was listening to a podcast, a business podcast. They were talking about a carnivore-rich diet. It's all about eating the meat and taking all the carbs away, the grains away. And they kind of said, yeah, we include the avocados and the healthy fats and a little bit of vegetables, but low glycemic vegetables. But then I thought, wow, here's a business guy giving advice, and he was raving about how he feels so good, but can't explain the science behind it. All he knows is that it works. And so I got to thinking, empirical evidence is all about what works for them. And I'm a true believer that balance is where it's at. And we need to really just be very vigilant about how our body works and what our body needs. And that does require another layer of intuitive eating so that we understand and read and really, really pick up on the messages that our bodies are constantly telling us, right? So I share with you all of this to say, not all doctors are the same. Not all doctors know without a shadow of a doubt what's going on with you. They too are just as confused as you sometimes when the labs don't match up with your symptoms, and they are trying to fill in the hole, trying to make sense of the data that they gather. But when you focus so much on the data, you forget the person who we're collecting the data from. So the data doesn't tell me something about me. My biochemistry doesn't really say anything about me. But if you're chasing a problem and you want to find a disease, chasing the biochemistry and the data might be helpful. But after you chase my problem, the imbalances, then you've got to at some point look at the person who has the imbalances, right? And then you have to look at their patterns, their ways of thinking, and then the ways of feeling, but more importantly, their state of being, of how they are. Are they happy? Are they, start asking more explorative questions to get to know your patients better. Like, I think those are some key markers that you should be looking for when you're looking to work with a practitioner. Number one, I believe it has to be sustainable. And number two, it has to be practical. Number three, it's got to be enjoyable. And number four, it's got to be simple and easy, right? It doesn't have to be so complex. And it needs to be adaptable over time, because not every supplement is going to be something you need for life. Not every kind of diet is something that's going to work for the rest of your life. You're going to have different needs at different phases of your life. So it's important to keep in mind that we all have these genetic and environmental variances and variables that we have to keep in mind that constantly shifts and changes the outcome that we're seeking to have. I'm going to share a story with you back in 2019. This is 2024 as I'm recording this podcast right now. It's end of February 2024. And in 2019, I remember I had really fallen sick. But shortly before that, my mom had come over and spent the weekend with me. My mom and I are really close, and there's just a lot of, I don't know, I would say upon, just reflection, I had a lot of anxiety around my mom, and I tended to be very hyper vigilant, meaning very nervous. And we were sitting in a dinner table with my two boys, and my older son was in high school back then, and my younger son was in middle school. And I remember her making a comment about my older son in comparison to my younger son. She favors my younger son over the older one. She made a comment, a very negative one, and just sort of categorized him as being something. And I remember it really triggering me from the deep within, because if you're a mother, you know what I'm talking about. If somebody else has an opinion about your kids, it really hits you the wrong way, especially if it's negative, especially if they're listening. My child was listening, and so I really took it personally. And I remember setting that boundary with her, and I told her, stop doing that. That doesn't feel good, and blah, blah, blah. And she just went on to gaslight me and said, well, of course, I'm a terrible mom. Of course, you don't want to hear this from me. Well, I better just leave. And to that, she said, well, maybe we should just cut ties, meaning that's her way always. Her ammunition with me has always been disowning me. And so I realized at that time, I take that back. I didn't realize that at the time. But I remember I too was so angry when she picked up and left. Of course, it didn't feel good, but I needed to let my anger out. And then it was sometime in May, getting closer to Mother's Day, but I know it was May 1st maybe. And 2 weeks later was Mother's Day. And I remember me starting to get sick in few days after that. And then one day I was coming to work, and then I just felt in this deep panic, because at work I got really sick, and I knew something was wrong, because I had this very, very high fever, and then I had this very big rash forming in my face that was so red. And I remember everybody around me were like, are you okay? Are you okay? And I knew something was wrong, but I didn't know what. But I remember going to the emergency room and them telling me, oh my gosh, you have a fever of 104, but you have no white count, complete neutropenia. And so I remember being admitted to the oncology unit, going through the bone marrow biopsy and going through every kind of antibiotic. And then they told my family after a week of trying to get my affairs in order because they didn't see a way out. And so it was really scary. It was only then that my mom buckled to come and see me in the hospital. But that says a lot about her, right? Because it's not that she's a bad mom, but I think she has a lot of insecurities of her own. And the way she mothered was a lot of manipulation and control and gaslighting. And I think that affected me, but that floored my white count because that really affected my ability to fend for myself and make sense of the situation. I didn't know why I was having this panic attack over my mom not talking to me. But it was really a hard time for me because I just would go into a heaving, like a panic attack where I didn't know what to do with myself. And I would cry and bawl, and I didn't know what to do. And every time I would call my mom, she would just hang up on me. That was her way of punishing me for disrespecting her. It's not so much the disrespect, so much as a lot of the times I think she's so insecure that she doesn't like to feel bad about herself, and I made her feel bad about herself. Whatever the reasons might be, I just knew that that wasn't right. But I share this with you to say that whatever you're thinking and feeling, sometimes we drive it to the point where we have a physiological effect. And I'm a true believer that a lot of the feelings and the symptoms that you have, they mesh together. And so it's not just about the symptoms. You really have to assess what things are triggering you time and time again to create this unease from within. Because there are many things. It may be your parenting style. It may be your unworthiness, lack of confidence. Then you have to start asking why, right? You have to start asking yourself why instead of just beating yourself up for what you think. Because a lot of us, without even knowing, we tell ourselves, oh my gosh, I'm so bad because, I'm such a bad parent because. And then we start to feel the guilt. We start to feel the shame. We start to feel the fear. We start to feel all the negativity. And then we start to go downward spiral, and that creates a biochemical hot mess within the system. And so I think the point that I want to drive home with this podcast is nothing other than to share these experiences with you, to number one, to tell you, I'm a practitioner of all this. Being on both sides of the fence really has given me the insights to really understand and read between the lines, to know when to seek the scientific evidence. But that only tells a partial picture. And then to look at the person who has these little data points, along with looking at what thoughts and feelings that they might be feeling every single day and asking the pertinent questions. And the three biggest pertinent questions that I ask all the time is their home environment, their marriage, their parenting. Do they feel safe in the house, happy in the house? Like, what's their status there, right? And then their relationship with themselves. And then, when we look at their home environment, we want to look at their relationship, right? Relationship with other people, relationship with themselves, as well as I want to look at what other stressors in their lives that's driving, or that might be driving and perpetuating something. Because I will tell you, what I mean by a practical and simplified approach is not complicating it by making you as the patient feel like I know best because I know all this information. I'm sharing this to let you know that sometimes my knowledge is not everything. It doesn't show me and tell me everything about you and what I need to know. And as a clinician who knows all the scientific backing and the educational background, I possess that. But then now the work becomes really tying it together with you and making art and connecting the dots together of who you are with the symptoms and the lab data points, and then integrating them and then providing you with a way forward that you can follow and live the solution every single day. So I think it's really important for you to really look at yourself in a brand new light, and whoever you see or seek help from, make sure that they see you and they ask you the right pertinent questions, not just be all about the labs and the data. And then look for somebody who's able to connect the dots artfully between who you are, all the thoughts and feelings that you might be having, and all your personal woes that might be contributing. And if they're not asking you those things to where they get to know you and assess what's going on, then it's going to be a huge problem, because that is what really triggers all the symptoms and the imbalances in the body. And it doesn't matter what kind of test, because that's already after the fact. If you can't cut the root cause, get to the root cause, and root cause may not be something you measure either. I found root causes like from deep diving into conversations with my clients and patients mostly. And so I think those are very key points. And really, the practitioner doesn't know everything. They can only understand your symptoms, but you know best what's been going on. You know best what feelings and thoughts that drove you to these actions. And then the symptoms arising, there's almost always a timeline that parallels everything that happens. So it's important to keep all those things in mind, to understand that you have many layers, and that the thoughts and feelings that you feel day to day and the stress, it's important because it has the physiological effect that creates this irreversible symptoms sometimes. So what do I want you to do? Well, the most important thing that I've begun to do is to meditate. And meditate isn't something that, you have to meditate for 20 minutes. You can start with a minute. Sometimes just taking a deep breath in, deep breath out, just to calm your mind, really resets your brain from going into that panic mode. Because when we go into that panic mode, there is no making sense, there is no logic, there's no rhyme or reason. Number two is, what's really helped me was to journal. Journal out, really keeping a diary, really at the end of the day or the beginning of the day. Just any thoughts that you come up, you just write what comes up. You don't curate, you don't filter, you just write what comes up. For me, like, there's so many thoughts looping every single day. I realized, there was just a lot of things, insights. And then I have memory recollections of the times when my mom hurt me, my sister hurt me, my brother hurt me, and when my ex hurt me, and how I responded. And then I think about what lessons could I learn from it? How can I move forward? As opposed to keeping it looping, because when they loop, guess what happens? When you think something, there's a feeling that arises. And so even though it's already happened, you have that, you create that over and over in your body to have this influx of biochemical reactivity, which is something you can nip in the bud if you can just write it all out, make sense of it, and ask yourselves better questions. How can I have done better? What can I learn from this? And then from there, you can detach so it doesn't loop over and over again. And to me, that's the work of self-study and self-reflection that allows you to be so much more composed, so much more calm and confident in who you are, and truly be authentic. Because I really admire those people who know who they are, they know who they like, they know who they want to be around, and they have set clear boundaries. And there's no negativity, but they will clearly tell you what they want, what they don't want, and they'll tell you no unapologetically. And I want you to start to do that. Live from that place of truth for you. And I think that is the hidden message, and that is the root cause of so many unnecessary suffering. So I hope that this has been an insightful episode. And if it resonated with you, I would love to hear back from you. Comment below and reach out to me. And I will see you guys all next week. Thank you for listening to the Mind Your Health podcast. If you enjoyed the episode, we would so much love it and appreciate it if you share it with someone who could benefit as well as to subscribe to this podcast on Apple Podcasts, Spotify, or anywhere else where podcasts are found. And leave us a review. We would be so grateful, and it helps us to reach more people just like you, so you can become more empowered to enjoy longevity and health. You can follow me on TikTok, Instagram, and YouTube at Dr. Connie Chung. And of course, you can subscribe to this podcast for a new episode every single week.